Have you ever felt lost in the maze of mental health professionals? You're not alone. Millions struggle to understand the difference between psychologists, psychiatrists, and therapists. But don't worry, we're about to clear up that confusion and empower you to make the right choice for your mental health journey. Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. Many people confuse the roles of psychologists, psychiatrists, and therapists because they all work in mental health and sometimes overlap in providing support. However, their training, responsibilities, and methods of treatment differ greatly. Understanding these differences is essential for anyone seeking the right kind of help. Choosing the correct professional can mean faster, more effective treatment, while confusion may lead to delays or inadequate care. Let's start by exploring who a psychologist is. Psychologists are mental health professionals who typically complete advanced degrees such as a PhD or Psy.D. in psychology. This involves years of research, training, and clinical practice. They're trained to conduct psychological assessments like IQ tests, personality evaluations, or diagnostic tools for disorders. Their specialty lies in talk therapy, using evidence-based methods like cognitive behavioral therapy or psychodynamic therapy to address a wide range of mental health issues, from anxiety and depression to trauma. However, it's important to note that in most countries, psychologists cannot prescribe medication. Their work focuses primarily on therapy, assessment, and behavioral interventions. That said, in some U.S. states like New Mexico and Louisiana, specially trained psychologists can prescribe medication under certain conditions. Now, let's turn our attention to psychiatrists. These professionals are medical doctors who specialize in psychiatry after medical school. Their training encompasses both medicine and mental health, giving them a unique perspective on mental disorders. As physicians, psychiatrists diagnose mental disorders, prescribe medication, and manage complex cases such as schizophrenia, bipolar disorder, and severe depression. While they may provide therapy as well, their main focus is often the medical management of mental illness. Psychiatrists often work in collaboration with psychologists and therapists, combining medication with therapy for a holistic treatment plan. For instance, a psychiatrist might prescribe antidepressants while a psychologist provides cognitive therapy, ensuring a comprehensive approach to mental health care. Lastly, let's discuss therapists, also known as counselors. The educational background of therapists can vary. They may hold a master's degree in counseling, social work, MSW, marriage and family therapy, MFT, or related fields. Their primary role is to provide talk therapy, emotional support, and coping strategies for individuals, couples, or families. Therapists help people manage stress, relationship problems, grief, or mild to moderate mental health issues. One of the advantages of therapists is their accessibility. They are often the most common entry point for mental health care, as they are more numerous and easier to access compared to psychiatrists or psychologists. This makes them an excellent first step for many people seeking mental health support. Now that we've introduced each professional, let's highlight the key differences between them. The most significant distinction lies in their training and qualifications. Psychologists hold doctoral degrees in psychology, psychiatrists hold medical degrees, and therapists usually hold master's-level qualifications. This difference in education directly impacts their roles and capabilities in mental health care. Another crucial difference is the ability to prescribe medication. Only psychiatrists, and in rare cases, some psychologists, can prescribe medication. Therapists and most psychologists cannot. This is why psychiatrists are often sought out for conditions that may require medication management. The scope of treatment also varies among these professionals. Psychologists emphasize assessment and therapy, using their extensive training to delve deep into psychological issues. Psychiatrists focus on medical treatment and medication, leveraging their medical background to address mental health from a physiological perspective. Therapists provide supportive counseling and practical strategies for coping, often dealing with day-to-day mental health challenges. So, when should you see each professional? If you need psychological testing, structured therapy, or treatment for behavioral problems and emotional challenges, a psychologist might be your best bet. They can provide in-depth assessments and tailored therapy plans to address specific psychological issues. For severe or complex mental illnesses where medication may be required, such as bipolar disorder, schizophrenia, or major depressive disorder, a psychiatrist is often recommended. Their medical training allows them to manage the complex interplay between mental health and physical health, especially when medication is involved. If you're dealing with everyday stress, relationship conflicts, life transitions, or if you want to begin with accessible talk therapy before moving into specialized care, a therapist could be ideal. They provide a supportive environment to work through common life challenges and develop coping strategies. It's worth noting that mental health care often works best when these professionals collaborate as a team. For example, someone with depression might benefit from a multifaceted approach: a psychiatrist prescribing medication, a psychologist providing cognitive behavioral therapy, and a therapist supporting the individual with emotional guidance and coping skills. This integrated approach ensures the patient receives both medical treatment and emotional/psychological support, addressing all aspects of their mental health. In conclusion, each professional has a distinct but complementary role in mental health care. Psychologists specialize in therapy and assessments, using their deep understanding of human behavior to guide treatment. Psychiatrists focus on medical and medication-based treatment, leveraging their medical training to address mental health issues from a physiological perspective. Therapists provide practical talk therapy and support, offering accessible mental health care for a wide range of everyday challenges. Recognizing these differences empowers people to make informed choices when seeking mental health care. It's crucial to remember that there's no one-size-fits-all approach to mental health. The right professional for you depends on your specific needs, the severity of your symptoms, and your personal preferences for treatment. Finally, it's vital to encourage people to seek help without stigma. Mental health support is as important as physical health care. Don't hesitate to reach out if you're struggling. Whether you choose a psychologist, psychiatrist, or therapist, taking that first step towards mental health care is a brave and important decision. We'd love to hear about your experiences with mental health professionals. Have you found the right fit for your needs? Do you have any questions about choosing the right mental health support? Share your thoughts in the comments below, and don't forget to subscribe for more educational content on mental health and psychology. Remember, your journey to a healthier mind starts here, and we're here to support you every step of the way.